High blood sugar, or hyperglycemia, is a primary driver of many diabetes-related complications. When the body can't effectively use glucose for energy due to insulin deficiency or resistance, it leads to a buildup of glucose in the blood. This high glucose level damages blood vessels and nerves, ultimately impacting various organs and systems. High after-meal blood sugar can happen, even without diabetes in some individuals. High blood sugar levels, known as hyperglycemia, often occur after meals, particularly for people with diabetes or prediabetes. It's a normal part of the body's response to eating, but can become problematic if blood sugar levels become elevated beyond the safe levels. But, in my personal view, they are likely to develop prediabetes later in life. When did you last check your after-meal blood sugar? Your comment is welcome. For healthy adults, after meal or 1 to 2 hours after eating, blood sugar levels should generally be less than 140 milligrams per deciliter, or 7.8 millimoles per liter. Some sources also suggest aiming for levels less than 180 milligrams per deciliter, or 10.0 millimoles per liter 1 to 2 hours after a meal. High blood sugar over time damages your body in many ways. These problems develop slowly, but good after-meal blood sugar control, good hygiene, and prompt treatment of infections can help. New research highlights the importance of controlling postprandial or after-meal blood sugar to reduce the risk of developing type 2 diabetes and associated complications. You might not notice the damages in the first few years of diabetes, but they happen silently, behind the scene. But they can become serious if left neglected and untreated. I am talking about after-meal blood sugar levels, because they are easy and cheap to measure. Also, most side effects develops when the blood sugar level is high after meals. The best way to control A1C or HbA1c is to control after-meal blood sugar. It is easy and cheap to test even at a lab, but a blood sugar meter is a great help. Number 1. Heart disease is a major concern for people with diabetes. When your blood sugar stays high, it damages blood vessels that carry blood to your heart. I had my heart attack in 1993 while I was still pre-diabetes, not full-blown diabetes. This can lead to heart attacks. The American Diabetes Association adopted the definition pre-diabetes in 1997. Even today, some doctors have no idea about this term and its definition. The cause of death of about 65% of people with diabetes will be from heart disease or stroke, both of which are parts of CVD. CVD stands for cardiovascular disease. It includes a variety of diseases and conditions affecting the heart and blood vessels. These diseases can include coronary heart disease, stroke, heart failure, and other related disorders. But good diabetes management can lower this risk significantly or even stop altogether. Cardiovascular disease deserves special attention because it's the leading cause of death among people with diabetes. The risk of a heart attack is 2 to 4 times higher in people with diabetes compared to people without diabetes. High blood sugar damages blood vessels and accelerates the formation of fatty deposits. These deposits narrow and harden your arteries. This condition, called atherosclerosis, reduces blood flow to your heart and other organs. A complete blockage causes a heart attack. Similarly, reduced blood flow to your brain causes a stroke. If not managed well, about 68% of people aged 65 or older with diabetes die from heart disease. But a comprehensive approach, including blood sugar control, blood pressure management, cholesterol management, not smoking, and regular exercise, can significantly reduce this risk. Number 2. Stroke happens when blood flow to part of your brain stops. People with diabetes have a 1.5 times higher risk of stroke. High blood sugar damages blood vessels in your brain. This makes clots more likely to form. These clots can block blood flow and cause a stroke. Controlling your blood sugar, blood pressure, and cholesterol helps reduce this risk. Number 3. PAD or peripheral artery disease affects the blood vessels outside your heart and brain. Its common symptoms include numbness, tingling, or a pins and needles sensation in the legs, feet, and toes, especially at night. Leg pain during activity that eases with rest, coldness, and changes in skin color. Some individuals also experience pain at rest, sores that don't heal, and mainly affects the legs. About 1 in 3 people with diabetes over 50 have this condition. Poor circulation leads to pain when walking. Your legs may feel tired or numb. But regular exercise, including walking, jogging, and good diabetes control, can help prevent this problem. Number 4. Kidney damage, also called diabetic nephropathy, happens in about 40% of people with diabetes. Your kidneys filter waste from your blood. High blood sugar makes them work harder. Over time, they can stop working properly. You might need regular dialysis or even a kidney transplant. But early treatment of diabetes and good blood sugar control can prevent or delay kidney problems. Wait, there is more, but do not forget to hit the like button if you think this video is useful. Number 5. Eye damage occurs because high blood sugar harms the tiny blood vessels in your eyes. This can cause diabetic retinopathy. About 90% of people who have had diabetes for 25 years will develop some form of retinopathy. This can lead to vision problems and even blindness. Diabetic retinopathy progresses through stages. In the early stage, tiny blood vessels in your retina weaken. They might bulge or leak fluid. You probably won't notice any symptoms yet. As it advances, new blood vessels grow haphazardly, damaging eye. These are fragile and can bleed easily. This is when vision problems usually start. About 90% of type 1 diabetes patients and 60% of type 2 diabetes patients will develop retinopathy within 20 years of diagnosis. But the risk of severe vision loss can be reduced by more than 90% with regular eye exams, controlling blood sugar, and prompt treatment. Cataracts develop earlier and progress faster in people with diabetes. The lens of your eye becomes cloudy. This causes blurry vision, faded colors, and trouble seeing at night. People with diabetes are 2 to 5 times more likely to develop cataracts, but cataract surgery is very effective and safe. Glaucoma risk is doubled for people with diabetes. This condition damages your optic nerve, often due to pressure building in your eye. Without treatment, it leads to vision loss and blindness. Early symptoms include losing peripheral vision and seeing halos around lights. But eye drops and other treatments can prevent vision loss if started early. But regular eye exams can catch problems early when they're easier to treat. Number 6. Nerve damage or neuropathy affects around 50% of people with diabetes. High blood sugar injures your nerves. Diabetic neuropathy, a type of nerve damage that can occur with diabetes. It's a serious complication of diabetes and can lead to various symptoms, including pain, numbness, tingling, pins and needles feeling, and weakness, according to the Mayo Clinic. This can usually start in your fingers and toes. See the video above. What is this peripheral neuropathy in prediabetes? Sometimes you might not feel injuries because of numbness, but controlling your blood sugar can prevent nerve damage from getting worse. Peripheral neuropathy is the most common form of neuropathy worldwide. In people with diabetes, about 50% develop peripheral neuropathy within 25 years. The symptoms vary widely. Some people feel burning pain. Others experience numbness. You might feel like you're wearing socks when you're not, or you might have trouble feeling hot or cold with your feet. Peripheral neuropathy increases your risk of falls. This happens because you can't fully feel where your feet are. Good blood sugar control is the best way to prevent nerve damage. But once nerves are damaged, the focus shifts to preventing further damage and managing symptoms. Number 7. Diabetic foot problems happen because of poor blood flow and nerve damage. You might not feel cuts or sores on your feet. These can become infected. About 25% of people with diabetes will develop foot ulcers. These can lead to serious infections. In severe cases, amputation might be necessary. But daily foot checks and proper footwear can help prevent these problems. Number 8. Skin and mouth infections happen more often in people with diabetes. High blood sugar weakens your immune system. This makes it harder to fight infections. Gum disease is twice as common in people with diabetes. But good oral hygiene and regular dental checkups can help prevent these issues. I gently and lightly brush my teeth after every meal and every snack. Just drink some plain water after even non-sweet drinks. Number 9. Osteoporosis, a disease that weakens bones, is more common in people with diabetes. They have a 6 times higher risk of fractures compared to people without diabetes. Osteoporosis is a condition where bones become weakened and fragile due to decreased bone density, increasing the risk of fractures. It's often called a silent disease because it usually doesn't cause symptoms until a fracture occurs, such as in the hip, spine, or wrist. But regular exercise, especially weight-bearing exercise, can help keep your bones strong. Number 10. Alzheimer's disease and dementia risk increases with diabetes. Alzheimer's disease is the most common cause of dementia. a brain disorder that causes memory loss and cognitive decline. It's a progressive neurodegenerative disease characterized by the buildup of abnormal proteins, like amyloid plaques and tau tangles, in the brain. This process damages neurons, leading to memory loss, confusion, and difficulty with daily tasks. People with diabetes have a 50 to 100% greater risk of developing dementia. High blood sugar seems to harm brain cells, but studies show that controlling your blood sugar, blood pressure, and cholesterol can help protect your brain. Mainly, you need to watch your after-meal blood sugar. Number 11. High blood pressure often accompanies diabetes. That's why the new term, metabolic syndrome, comes. Most of the doctors of older generation have no idea about this fact. It is a cluster of conditions, including high blood pressure, high blood sugar, excess abdominal fat, and abnormal cholesterol levels. This significantly increases the risk of developing serious health problems like heart disease, stroke, and type 2 diabetes. It's not a single disease, but rather a collection of risk factors that often occur together and elevate the chances of developing these more serious conditions. About 2 out of 3 people with diabetes also have high blood pressure, and vice versa. This combination increases your risk for heart attack and stroke even more. But lifestyle changes and medications can help manage both conditions effectively. See the video link above named 12 Proven Ways to Lower Blood Pressure Naturally. Number 12. Diabetic ketoacidosis, or DKA, is a serious condition that can happen when your blood sugar gets very high. Without enough insulin, your body breaks down fat too quickly. This produces acids called ketones, which can make your blood too acidic. DKA affects about 5% of people with type 1 diabetes each year. But recognizing early warning signs like extreme thirst and frequent urination can help you get treatment sooner. Number 13. Hyperosmolar hyperglycemic state happens when blood sugar rises to extremely high levels, often above 600 milligrams per deciliter. This pulls fluid from tissues, including your brain. It's more common in older adults with type 2 diabetes. The mortality rate can be as high as 20%, but prompt medical treatment can reduce this risk. Number 14. A weakened immune system makes fighting infections harder. People with diabetes get more infections than people without diabetes. Infections can also make blood sugar control more difficult, creating a troubling cycle. But good. After-meal blood sugar control, good hygiene, and prompt treatment of infections can help. Number 15. Limb amputations are a serious complication of diabetes. Every year, more than 73,000 Americans with diabetes have amputations. These usually happen after foot ulcers don't heal. But comprehensive foot care programs can reduce amputation rates by 45 to 85%. Number 16. Cardiomyopathy is a disease of the heart muscle. It makes it harder for your heart to pump blood. People with diabetes have a 2 to 5 times higher risk of developing this condition. But early detection through regular checkups can help start treatment before serious damage occurs. Number 17. Liver disease, specifically metabolic dysfunction. Associated steatotic liver disease affects many people with diabetes. About 70% of people with type 2 diabetes have fatty liver disease. This can lead to liver inflammation and scarring. But losing weight and controlling blood sugar can improve liver health. Number 18. Joint problems like osteoarthritis happen more often in people with diabetes. Extra body weight puts stress on joints. High blood sugar can also directly damage joint tissues. About 52% of people with diabetes report arthritis, but staying physically active helps maintain joint health. The age when diabetes starts matters too. Young people with type 1 diabetes have an 8.2% chance of developing peripheral neuropathy. But young people with type 2 diabetes have a much higher risk, about 26%. My view is people with type 2 diabetes does not care much, while people with type 1 take care of them very diligently. Current world record for longest living person with diabetes is held by a person with type 1 diabetes. Libby Lashansky, a great-grandmother from Long Island, was diagnosed with type 1 diabetes at age 11 and is now 92. Defying predictions that she wouldn't live past age 15. This shows how important early detection, proper blood sugar control, and treatment are. The longer you have diabetes, the higher your risk becomes. After 10 years with diabetes, about 40% of people have some form of neuropathy. This jumps to 50% after 25 years. Mononeuropathies affect specific nerves. They're less common but still affect up to 10% of people with diabetes. These often come on suddenly. You might wake up one day with pain or weakness in a specific area. For example, carpal tunnel syndrome affects about 23% of adults with diabetes. This happens when a nerve in your wrist gets compressed. Your hand might feel numb or tingly. But these conditions can often be treated with specific exercises, braces, or sometimes surgery. Autonomic neuropathy affects the nerves that control your internal organs. This can cause problems with digestion, heart rate, blood pressure, and other bodily functions. About 30% of people with diabetes develop some form of autonomic neuropathy. You might experience dizziness when standing up, digestive problems, or bladder issues. Men might have erectile dysfunction. These symptoms can significantly impact quality of life, but medications can help manage many of these symptoms. Now let's talk about how diabetes affects your feet in more detail. Poor circulation combined with nerve damage creates a dangerous situation. You might develop calluses that turn into open sores. Because of nerve damage, you might not feel these sores. They can become infected. About 15% of people with diabetes develop foot ulcers. The healing process is slower when you have diabetes. Blood carries healing nutrients and oxygen, but damaged blood vessels deliver less of these to your wound. An infection can spread to your bone. This is called osteomyelitis. In severe cases, amputation becomes necessary. Every year, diabetes causes more than 73,000 lower limb amputations in the United States. But regularly checking your feet, wearing proper footwear, and getting prompt treatment for any wounds reduces this risk dramatically. Your skin is also affected by diabetes. High blood sugar provides an ideal environment for bacterial and fungal infections. Common skin conditions include bacterial infections like styes and boils. Fungal infections like athlete's foot and ringworm are also more common. About 33% of people with diabetes will have a skin disorder at some point. These infections can happen anywhere on your body, but they're most common in warm, moist areas like between toes or in skin folds. Keeping your skin clean and dry helps prevent these infections. But if you notice any unusual rashes or sores, it's important to get them checked quickly. The good news is that you can prevent or delay many diabetes complications. Good blood sugar control is the foundation. Research shows that every percentage point drop in A1C, a test that measures average blood sugar, reduces the risk of complications by 40%. This means if your A1C drops from 8% to 7%, your risk of complications falls significantly. Regular medical checkups help catch problems early. Your doctor should check your feet, eyes, kidneys, blood pressure, and cholesterol regularly. Early treatment prevents small problems from becoming big ones. For example, finding and treating eye disease early reduces the risk of blindness by 95%. A healthy lifestyle supports good diabetes management. Eating nutritious foods helps control blood sugar, blood pressure, and cholesterol. Focus on low-carbohydrate vegetables, fruits with less sugar, whole grains and legumes with less than 50% carbohydrates, lean proteins and healthy fats like monounsaturated and polyunsaturated. Limit processed foods, sweets, and foods high in sodium. Ask your family to help controlling the blood sugar by not eating sweets in front of you. Ask them to avoid filling the fridge and cupboards with sweet foods. Physical activity improves insulin sensitivity. This means your body uses insulin more effectively. Exercise also helps control weight, reduce stress, lower blood pressure, and improve circulation. Aim for 150 minutes of moderate activity each week, but start slowly if you haven't been active. Not smoking is crucial for preventing complications. Smoking narrows blood vessels. This worsens circulation problems caused by diabetes. People with diabetes who smoke are 3 times more likely to die of cardiovascular disease than those who don't smoke. Taking medications as prescribed is essential. Many people with diabetes need medications to reach their blood sugar targets. Some also need medications for blood pressure, cholesterol, or other conditions. These medications work together to protect your overall health. Living well with diabetes is possible. Many people with diabetes never develop serious complications. They lead full, active lives. The key is taking diabetes seriously and making management a priority. But you don't have to be perfect. Small improvements in blood sugar control reduce your risk of complications. While diabetes complications sound scary, understanding them helps you take action to prevent them. Knowledge is power when it comes to diabetes management. With good care and healthy habits, you can reduce your risk of complications significantly. Working closely with your healthcare team helps you create a personalized plan for preventing complications. Everyone with diabetes is different. What works for one person might not work for another. Your healthcare team can help you find approaches that fit your needs and preferences. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. See you in the next video.